Hi, everyone. I'm Carrie Pena, and we want to welcome you to the Arizona Department of Health Services Vaccines for Veterans Town Hall. We have an amazing lineup for you today, and thank you so much for jumping on with us for this important discussion. We certainly want to take your questions and pay attention to all of your concerns. Right off the top here, it is my great honor to introduce Colonel Wanda Wright, and Colonel Wanda Wright is the director of the Arizona Department of Veterans Services. She has 3 decades of military experience and is the 3rd generation of her family to serve in the U.S. military. Colonel Wright.
Thank you so much. Well, good afternoon, everyone. On behalf of the Arizona Department of Veterans Services, I'm happy to welcome everyone who joined us today for this vaccine town hall specifically for veterans. At ADVS, we are proud to be stewards of a sacred obligation of serving Arizona's military and veteran community. We do that by providing direct services to service members, veterans, and their dependents, like our veteran benefit counselors who provide no-cost assistance with accessing a variety of benefits and services earned through service. We also manage 3 Arizona veteran memorial cemeteries located in Sierra Vista, Marana, and Camp Navajo, and 2 soon-to-be 4 Arizona State veteran homes located in Phoenix, Tucson, Flagstaff, and Yuma, as well as many other statewide programs that serve veterans. We believe honoring veterans is done not only through ceremonies, proclamations, coins, and other initiatives, but also through action and advocacy. Part of our mission is to make sure all veterans have access to not only benefits and services that they've earned, but also to information. And that's what brings us here today. As we go through this town hall, I encourage everyone to remain open to this conversation and ask questions. That's what we're here for. We brought together subject matter experts from across the state that can address any thoughts or questions you may have about the COVID-19 vaccine. I look forward to this conversation. Thanks so much.
Thank you so much, Colonel Wright. And again, to everyone who's joining us, we appreciate you being here because we care so much about our veterans here in the state of Arizona. And again, I'm Carrie Pena, a journalist based here in Phoenix, and I'm really proud to be here with all of you today. And now it is my pleasure to introduce our distinguished lineup here. And again, we do want to take all of your questions. We're going to hear from folks right off the top here, and then we'll be taking questions, and we certainly want to hear from all of you. We have Dr. Richard Carmona, the 17th U.S. Surgeon General and the Special Advisor to Governor Ducey on public health preparedness with us today. Dr. Alicia Smith is the Director of the Phoenix VA Healthcare System with us as well. Jennifer Kutalski is the Director of the Southern Arizona VA Healthcare System. Stephen Sample is the Interim Director of the Northern Arizona VA Healthcare System. And the Assistant Director for Public Health Preparedness, Jessica Rigler, is on the line with us as well. And we also have ADHS Immunization Program Medical Director, Dr. Karen Lewis, on the line to help answer all of your questions. And we are really looking forward to hearing from all of you, so you can hop in there and start sending your questions our way. You can view the panelists' full bios on the ADHS website, and that is azhealth.gov/COVID-19 veterans. And to find a COVID-19 vaccination site near you, you can visit azhealth.gov/find vaccines. This event is being recorded and it will be available for later viewing on the ADHS website and the YouTube channel. And if you have any questions for the panelists to answer during today's Q&A session, you can submit them by commenting in the Zoom webinar. And I see some questions coming into us live right now, or the Facebook live stream. Thanks to all of you joining us live on Facebook right now. Just jump into the comment section, of this event. And please, if you will, include where you're joining us from so we can get to know all of you, the wonderful veterans here in Arizona and family members concerned about this topic and finding out more information. If we are unable to address any of the questions during the event, we do want you to email them, because the whole point of this is giving you answers. So you can email aztownhalls@azdhs.gov. Once again, the email is aztownhalls@azdhs.gov. And now I want to bring in Dr. Richard Carmona. And Dr. Carmona, you have been out there sharing your wisdom and talking to people so openly about this topic with COVID-19. Where are we at? What's next? I'd like to start by asking you, sir, why was it so important for you to participate in this particular town hall?
Well, Carrie, first of all, thank you so much for emceeing this for us today. And I want to give special thanks to Colonel Wright, our VSOs, our VA partners, the leadership that's here today, because it's a team. And in the military, we learn to act as a team. Why this is so important to me is that in all my life, all the titles I've had, maybe one of the most important, if not the most important, is being a veteran, because I'm a member of a very small fraternity who've had the privilege to serve this nation. And it's truly a minority. And so we stick together. And so I'm a U.S. Army Special Forces combat veteran, and I'm also a disabled veteran, combat disabled veteran. And I was fortunate enough over many years in more education, starting out as a private and eventually getting more education to Mustang up and come back in as an officer and end up as, going from E1 to 09. So I don't forget all of the great opportunities that our military has afforded me to become a better American. And so this is personal for me. My family has served for 2 generations as well. My nieces, my nephews, my brother, we're all military folks. So in a long answer to your question, it's personal. This is not about just speaking as Surgeon General. It's speaking to my battle brothers and sisters, because we all wear the same shoes, the same cloth, and we all go downrange together and take the same risk. And it's up to us to make sure that when that risk is accepted, that our Veterans Administration, who does such an admirable job, is there to make these young men and women whole again, every possible way they can. So that's why I'm here. And I want to reach out to my fellow veterans to talk to them about the vaccines and the importance of the vaccines. The veteran understands vaccines pretty well. Why? Think about any time we get deployed downrange, you get vaccinated, because we need to be able to stay healthy in battle. That's battle readiness, okay? So it's secondary to us. We know we put our arm up and get a shot because we're going to someplace with a disease that we don't want to get, because that impairs our ability to represent our country. In addition, all of us, many of us have families and we have children, and our children get vaccinated against vaccinatable diseases. So what I would tell my fellow veterans, remember that. Don't be confused by the misinformation that's out there, because vaccines work. And I would say that in the history of mankind, vaccines are probably the most important scientific advancement to date in the history of mankind, because diseases that we used to see that would decimate populations, that doesn't happen anymore, okay, because of vaccinations. But I do understand there's been confusion out there, and that is why our colleagues at the Arizona Department of Health Services decided that this was something we needed to do, to get out and speak directly to our veterans, but we knew we couldn't do it alone. And of course, we bring in our VSOs, we bring in the state Veterans Office as well. We bring in the leadership of our VA hospitals, because we're all aligned about a specific mission to make sure our veterans get the best healthcare, and that includes getting vaccinated. Booster doses are one thing that people are wondering about. They get confused. Well, I had COVID already, so I don't need to get a booster. That's not true. The fact is, the booster gives you elevated immunity. So even if you've had COVID, you should still get vaccinated and get a booster. If you haven't had COVID and you didn't get vaccinated because you weren't sure, you're not sure, I'm your combat medic. I'm telling you, you should do it, okay? Because you're out there every day getting exposed, and we don't want you to get sick if you get exposed. For those of you who are older, you're even at higher risk. For our Vietnam veterans, of whom there are many, many still around, our younger veterans that have served in the last 20 years in both wars, Afghanistan, Iraq, and so on, as you're getting older, your immunity system doesn't work as well. These vaccines boost your immunity system to protect you from COVID, just like the vaccines you got when you went downrange to prevent you from getting all those bad diseases, or the vaccines that your children get against measles, mumps, rubella, smallpox, all of those things. Vaccines are important. In our state, what we know now is about 41% of eligible adults in Arizona have received a booster dose. That climbs to over 60% for those 65 and older. But the other side of that statistic is about 40% have not. And within that group of 40% who have not gotten the booster, we have veterans. And because they didn't get the booster, they're more vulnerable. Because especially if you're of the Vietnam era or above, and even for some of the Korean veterans that are still around, you're at increased risk if you get that infection. If you look at how many people in hospitals today, how many people on ventilators, how many people that die, and you look to say, well, how many of those weren't vaccinated or didn't get boosted? The majority of those people are the ones that didn't get boosted. The fact is, if you get vaccinated, you still may get sick, but you won't get sick as bad. You probably won't go to the hospital. You probably won't be on a ventilator, and you're most likely not to die if you get vaccinated and boosted. So those are the messages that we want to get out to our fellow veterans. And again, I'm looking at this as a team. No matter what uniform service you were in, we all accept the charge of our nation to serve all over the world. We accept the fact that we go into harm's way every day. And to do that, our government, our uniform services prepare us very, very well, depending on what your MOS is, to drop you into an area to be able to defend or to protect all of our values as a nation. And part of that is a booster. Okay, remember, you don't go into harm's way. All of your medical officers within your companies, your battalions, your divisions, when you go downrange, they're checking your shot record. You all remember that. Okay, I want to check your shot record now. I want to make sure you've got vaccinated and boosted, because I know that's what's best for you. And I would never ask you to do something I didn't do. When the vaccines were available, I got vaccinated. I've had all my shots and I got my booster. In fact, there's science that's evolving now. In some cases, we're looking at even another booster, especially for senior citizens. The science isn't fully there yet, but we're monitoring it. And when it's out there, we'll get back to you and let you know. But for now, we want you to know vaccines work, boosters work. You should get that. And please don't be confused by all of the disinformation you see out there. Go to reliable sources. Go to the Arizona Department of Health Services. Go to the Department of Veterans Affairs on the website. Go to a place that's not trying to sell you something or give you misinformation, but you can rely on that information that they give you and follow their instructions. Hence why we are here today, because you can ask all your questions. And if we don't answer them all today, I will personally send you all emails to make sure you get your questions answered, because I want to make sure that you all are battle ready and life ready every day. And you need your boosters to do that and your vaccines. Thanks very much, Carrie. And I'm so happy that you're moderating this for us and letting us connect with our battle buddies all over the state.
Thank you so much, Dr. Carmona. And we are getting a lot of questions, and I promise we'll get to the questions in just a moment. I do want to introduce a few more panelists and have you each say a few words to our distinguished audience. Dr. Smith, I'd like to bring you in first, if you would, and just what would you like to say as your opening remarks?
Hi, good afternoon. Thank you so much. It's really an honor to serve the veterans of the Phoenix VA catchment area, which is in the south central portion of the state of Arizona. And it's a privilege to be here with you today to represent the 3,700 plus employees that we have at the Phoenix VA healthcare system. We're now serving, last year we served more than 110,000 unique individual veterans. And we've completed more than 1.7 million outpatient visits. And so Phoenix is really growing, and we're proud that we're experiencing that growth. I would also share with you what I'd love to share is that we've been had a consistent role during the COVID pandemic, and we certainly are here to continue that role with vaccinations. And so Phoenix has had a number of vaccination clinics across the valley. Has done pretty significant outreach to our rural areas as well as our homeless veterans, a critical and vulnerable population. And so we plan to continue. You can get vaccinations right now at the Phoenix VA healthcare system at our Carl T. Hayden medical center down on 7th Street and Indian School. You can get it at many of our community-based outpatient clinics without an appointment. So if anyone after this town hall today, if you're a veteran and you'd like to get your vaccine, please don't hesitate to reach out or just walk right in between 7 and 4:30 and we can give you your vaccines. I'll share one final thing that I'm really proud of with our healthcare system, or several things I'm proud of, but one thing I'd really like to highlight. As we've continued to grow, we're going to continue to serve veterans with a new community-based outpatient clinic that's going to be at 32nd Street and Van Buren. This new outpatient clinic will have over 200,000 square feet of state-of-the-art space to allow us to continue to serve veterans. And during the pandemic, we actually served Arizonans as well, and we plan to continue to support not only our veterans, but the state of Arizona during times of crisis. So I look forward to answering your questions. There's so much that I can tell you about the Phoenix VA, but I will turn it over to my other panelists, and then I'm happy to answer questions as they come up. Thank you.
Dr. Smith, thank you so much. I'm already seeing a lot of great questions rolling in here. I want to turn it over now, though, to Jennifer Kutalski, who is the director of the Southern Arizona VA Healthcare System. Jennifer?
Yes, thank you so much. And it is an honor and privilege to join today. And thank you for giving me the opportunity to share what's happening here at the Southern Arizona VA Healthcare System. So for those that may not be familiar, we cover as far west as Yuma and as far north as Casa Grande. Our healthcare system serves over 65,000 enrollees, and we have 7 community-based outpatient clinic locations. Yuma and Casa Grande, we have Safford, Sierra Vista, Green Valley, and we have 2 community clinics in the metropolitan area, one in Northwest Tucson and one in Southeast. We are very proud of the care we provide. We have about 1/3 of our employees are veterans themselves, or like me, have a connection to the mission. So my father is a Vietnam veteran, and he gets all his care from the VA. And you bet I had him in line with the veterans when it was time for vaccination and getting his booster as well. So I'm really proud of the work that we do here. And, I just want to share that all of our veterans are eligible to get a COVID-19 vaccine on a walk-in basis at our main medical center here in Tucson. And for our rural veterans, you can make an appointment at any one of our community clinics, and we'll be sure to be able to provide you that service. And I also want to mention we can provide vaccine to spouses and caregivers of veterans. So you may not know that. We want to make sure we get that message out to make sure that we're keeping our veterans and caregivers and spouses vaccinated against COVID-19 as well. As mentioned by Dr. Smith, we too here in the Southern Arizona VA have been serving to support the community during this pandemic, as well as our veterans. We were called upon to help serve for the Arizona Surge Line, accepting even non-veterans into our healthcare system to be cared for. We provided support for Indian Health Services. We provide support for many nursing home locations in terms of PPE. We partnered with our state veteran home that is co-located here on our campus and provided some vaccine training and support as well. So we're very excited to be part of today's town hall to get the word out about vaccine and booster and information. I'm looking forward to answering any questions that may come forward. So thank you again for having me on today's panel.
Ms. Kutalski, thank you so very much for that. And finally, I want to go over to Stephen Sample, who is the interim director of the Northern Arizona VA Healthcare System. Stephen?
Great, thank you, Carrie. And it's a pleasure to be on this call as well to talk to my fellow veterans. I spent 23 years on active duty. I retired and then started working with the VA. I wanted to keep working with my brothers and sisters in arms, and I think this is a great opportunity and a very noble mission. We are the smallest VA in the state of Arizona. We serve just 30,000 unique veterans, but the challenge for us is really we serve the rural and highly rural population. So it's really important, as Dr. Carmona mentioned, about getting the vaccine out to the people, especially we focus on rural Arizona, so we have a lot of initiatives in place to do that. I'm proud to say we were the first VA in the state to start providing the vaccines out at our CVOCs. We have 5 CVOCs located pretty much in the northern part of the state. So we have Lake Havasu, Kingman, we have one in Flagstaff, one in Cottonwood, and then one in Anthem. So we serve from Anthem all the way north and then border to border across northern Arizona. You know, Dr. Carmona talked about the importance of the vaccine. And, you know, I myself got the vaccine back when I was in Tucson. So I got both doses back in January, the first year that it was offered. And then in August, I ended up getting COVID. So I was one of the early breakthrough cases when we look at that. I did get a booster in November. But what we saw, especially with this latest surge, and that's the busiest we've ever been when we had the Omicron surge, and we did see an uptick in people that had been vaccinated getting Corona or getting the COVID virus. But what we found is those that were getting vaccinated were much less likely to be hospitalized. And I think that that speaks volumes of why we want to make sure veterans have the opportunity to hear about the vaccine and then to get the vaccine. We do offer that at the CVOCs, that is by appointment. And then we have a walk-in service or by appointment here on main campus. And for any veterans in Northern Arizona, they could call our appointment line and get more information. That's at 928-717-7406. Thank you.
Thank you so much, Mr. Sample. And we are getting a lot of questions, so I want to get to the Q&A portion now. Just to all of you who are watching this live or perhaps viewing this at a later time, I want to give full disclosure here that we have a lot of experts. I can't see everyone on my screen right now, so I'm going to do my best to direct your questions to the right person. And to our panelists, again, feel free, please, to jump in there if it is something that is certainly pertains to your area of expertise. And right now, Dr. Cremona, I'd like to go to you first and just ask you, what question are you getting the most when you're out and about and you're always so receptive to talking to folks? What question are you being asked the most?
I think the most common question I get is about the vaccine itself, and people were confused. Well, we transitioned from an initial vaccine to then the booster, then another booster, you know, if you're in the mRNA series. And people say, why didn't they tell me that in the beginning? I mean, because what happens is it created some uncertainty, and that's a messaging issue. It's not a science issue. It's that we didn't know much about this virus 2 years ago, okay? And the fastest time in history, we came up with a vaccine. And so on day one, when we started talking about vaccines, all of the science wasn't in yet. And the science keeps changing almost every day, every week. As we get new information, it changes. So for instance, now, as I mentioned in my remarks, 2 boosters is standard right now, but this morning I was on the White House call for this very purpose, and they were talking about most likely they're going to recommend another booster for those that are seniors or those that have immunocompromised immune systems. So the point is the science keeps evolving. It's not that the scientists didn't tell you the truth or the politicians didn't. It's just they didn't have all that information. We're learning as we go with COVID, and we'll continue to gain more information. So that's why when I speak to my fellow veterans, I said, I jumped on board right away because this is 20 years of science in mRNA viruses that came to the forefront during COVID. It's not like it was invented yesterday. The best science accumulated, vaccines were made, and they were sent out right away. So I would tell my veterans as well, my fellow veterans, don't be surprised if you hear more information the next few months, the next 6 months about as we learn and have more data, we'll be able to be more precise.
And Dr. Carmona, I'm going to follow up with you with the question coming into us live here. Steve, who is texting me the question behind the scenes. Thank you so much, Steve. The question is, I just finished chemo and radiation. How long should I wait to get the booster shot?
Okay, those are very specific questions. So that would fall into the immunocompromised patients. So you have patients, for instance, that have organ transplants. They're immunocompromised. You have people that have chronic diseases, like they're on steroids and other medications that help them get through their bad disease, but the side effect is their immune system is suppressed. Those questions have to be addressed specifically to your physician because that's part of a longer treatment plan, when the timing would be better. So there's not a specific answer for everybody, but people who are immunocompromised, for instance, the ones that have organ transplants, they also get vaccinated. And there's actual studies going on now throughout our state on those populations to find out how they respond to the vaccine and how much or how many boosters they may need, if so, because it's a different population. So I would advise that veteran, talk to your oncologist, talk to your primary care doc, and ask them specifically about your case because it has to be part of a larger treatment plan.
And then I want to ask whoever thinks that they are best suited for this next question from the Arizona Department of Health Services. The question is, do Arizona and or Pima County have plans in place for the next variant in regards to testing, therapeutics, et cetera?
May I suggest that maybe Jessica jump in because she oversees this area for the state, and I'd be happy to talk about it on a national level as well when Jessica's done.
Thank you, Dr. Carmona. And thank you all who are attending this call to get information and for your service as well. That was a great question, really. What comes next? We anticipate there will likely be future variants of COVID-19. The good news is that we have really good strategies in place already, and more science is evolving that is providing more opportunities to support people who become infected. So for example, there are multiple therapies that are available now through monoclonal antibodies or antivirals for individuals who do become infected with COVID-19. And you can access those through your physician or where you receive your health care, as well as with a prescription through a local pharmacy. There are programs like that in place. We will continue with our vaccination campaigns as well. And there's been another round of free test kits available that you can order from the federal government as well, so you can stay testing at home when you develop those symptoms also. We'll continue down the path of the strategies that we've been honing in over the last several months that involve availability of vaccines, of testing, and of treatment for individuals who do become ill.
If I might add on then on this, I want to reassure my fellow veterans, being the advisor to the governor and working closely with Jessica and Don Harrington, our state director, these are questions we talk about almost every day, okay? What have we learned from this experience over the last 2 years? How do we become even better? And when I look at a national level as Surgeon General, I was at the table when we put together what's called the National Response Framework, which is the plan. I'll put it in terms of veterans. It's an order of battle. It's a battle plan on how you move forward when you receive a threat. The threat can be any of what's called all hazards. It could be man-made, it could be naturally occurring, earthquakes, tsunamis, it could be a terrorist event, or it could be a pandemic. Same resources have to surge to be able to address that. So at the national level, just like at the state level, we're already asking the questions. Was the supply chain sufficient? Where were we not up to par where we should have been? What new things do we have to add in? Because when we look at the arc of preparedness, it starts with preventing something from happening. Then we respond to that. Then we try and mitigate it. Then we recover from that. And we've gone through that whole arc now, and we're kind of toward the end, but we're not out of it yet, as already many of you have implied, because there's still variants that can cause a problem. But we've learned a lot. Now it's our responsibility at the national and state level to look at this experience and say, how do we make it better next time? How do we memorialize these experiences and make sure that the generations behind us don't have to reinvent the wheel the next time a pandemic or any all hazards threat comes before us?
And Dr. Cremona, I'll stay with you for a moment here. Another question that came into us, I heard there's a new variant called Deltacron. Will vaccines or boosters protect against that?
So let me put the issue of the variants, which are mutations, and the variant is the clinical manifestation. So viruses change all the time. We expect that. You know, Darwin told us all organisms continue to mutate in order to survive in an environment. And so this virus continues to change. To our scientists who are doing what's called sequencing in our laboratories around the state and country, what that means is they're actually looking at the genetic makeup of the virus. And what they ask us two questions: has there been a change? And if it is a change, is it a change that's clinically significant? Most of the changes are not clinically significant, meaning, okay, big deal. One particular protein was substituted for another. But when it's clinically significant, that means it's more transmissible. Maybe it is more lethal. Maybe, and it hasn't happened yet, it is less able to be taken care of by our vaccine. To date, all of the variants that we've dealt with seem to still be amenable to the vaccines we have. So therefore, you should get your vaccine, you should get your boosters, because that's the best way to protect yourself. Irrespective, right now, I think our BA2 is the predominant one. I think somewhere around 75% in the country. So that's probably not important to all of you, but what we see is the variants change from time to time. And when you see one being more transmissible, you worry. But then the first thing to ask is, does my vaccine still work? And is it any more toxic to people? And so far, we're doing okay with the vaccines and boosters we have.
And Dr. Carmona, since you are the special advisor to Governor Doug Ducey, I know that Governor Ducey, I've done a lot of reporting with him, and I know he cares a lot about the issue with folks in nursing homes.
Yes.
So we had a question here, someone saying, I just heard that seniors in nursing homes are not getting boosters. What are you doing about this? And perhaps we'll go to you first, and then one of the folks from the Arizona Department of Health
Terrific.
Services.
Well, first, again, I want to give a shout out to my colleagues, Don Harrington, Jessica, Steve Elliott, the whole team. I mean, they run an extraordinary operations 24/7. You don't see it, but data is coming out all the time. I meet on a weekly basis with all the chief medical officers, and I report back to Jessica and Don and so on. We share information all the time. So I want to make sure everybody knows this is a conversation that's going on every single day, every single hour to benefit our public and our veterans. As far as the nursing home issue, I'm going to kick it over to Jessica in just a minute, but what I want to say, one of the neatest things that was done in the beginning was to say, who are our vulnerable populations in the state? And if you remember where COVID first started, it was up in the Northwest where a whole nursing home was wiped out initially because people didn't appreciate the magnitude of the problem. So what we did here is to start to figure out what heightened awareness do we have to have in nursing homes? How do we get into those nursing homes and vaccinate the people that are highest risk? And so that started very early in our response to this problem. So I'll kick it back to Jessica now, and she can give you more details on that. But I'm very proud that we did identify not only seniors, but what about the migrant workers? What about the people that are in far off rural areas? We put vaccines in vans and went to them to make sure they could get vaccinated, including veterans. Jessica, please.
Thank you, Dr. Carmona. Yes, as Dr. Cremona has mentioned, we have had a specific focus on vulnerable populations to ensure that folks that are most vulnerable to severe outcomes from COVID-19 are protected. We continue to watch the data from nursing homes, and it is a little bit lower as far as booster uptake goes than we would like to see in those locations. We've been working very closely with our partners at skilled nursing facilities and organizations around the state. And we have a program that's been ongoing for several months that will offer vaccine clinics at these long-term care facilities or skilled nursing facilities for free. So facilities are able to reach out to the department and we can get them scheduled, and we cover the cost of coming out to those locations in order to provide vaccinations to residents and staff. Health equity at azdhs.gov is the email address for facilities leadership to contact if that's something that they're interested in, and we continue to promote that program so we can ensure we're reducing all barriers that we can into providing vaccines to our seniors.
Jessica, thank you so much. And this next question I would like to direct toward you, Dr. Smith. The question is, what are the VA's protocols for the second booster shot? And then they say this may involve word that Pfizer is recommending a second booster dose. That's the question there.
I thank you. What I would say is at this time, we are giving the two vaccines in, we have at the Phoenix VA, we have Pfizer. And so we're giving the two vaccines and then the booster dose. Certainly individual veterans can speak with and should speak with their provider about if a next booster or another booster is indicated and what the timing for that would be, to make sure that if there are any specific clinical considerations, you go over those with your provider. But again, we're available. The vaccine is available. You don't need an appointment. You can come in and get your vaccine. And again, the vaccine is 2 doses in the series and then a booster, and then subsequent booster discussions. I would really encourage you to have those discussions with your individual primary care providers.
Did any other experts want to jump in on this part of the question here? I know boosters is a huge topic right now.
Yeah, if I may, as the director for the Arizona Department of Veterans Services, we have 2 state veteran homes that have long-term skilled nursing for our veterans. And we have a 99% vaccination rate for our resident veterans who live there. And I think it's pretty close to that for the booster as well. We offer them that opportunity and they definitely wanted to take it. And as well as our staff, we are Currently, I think about 85% on average in both of our homes for the staff having vaccine and boosters. So I think it's important, and the VA could probably talk to their community living centers as well. I think there's very high participation for the vaccine and the boosters.
Anyone else to jump in here? I have a lot of questions. We have a great audience, so thank you all so very much. I believe this next question might be best for you, Dr. Lewis. This is a question about, it says, we have a vet who had a severe reaction to the swine flu vaccine, and he is wondering if he should get the COVID vaccine.
The swine flu vaccine was a type of influenza vaccine. COVID vaccines are completely different than influenza vaccine. So somebody who can't get an influenza vaccine can still go ahead and should still go ahead and get the COVID vaccines as recommended.
Thank you so much, Dr. Lewis. And I'm going to go now to another question here. And I think maybe this one for you, Dr. Carmona, and if anyone else wants to jump in here, certainly please feel free. I never got sick working out of school for 20 years. My immune system was amazing. I did not get the vaccine when this all started. I finally got it. And after the 2 vaccines, within 3 months, I got COVID. I had allergy problems and more. Why would this be? What could the shots have done to my immune system?
Okay, well, that's a great question. And it's one of those things that, you know, the average person doesn't understand. We forget a lot of times that, you know, we are very conversant in all of these terms. And in the last 2 years, almost every citizen has become an epidemiologist and a vaccinologist. Think about it, terms that they never had to even think about before. So first and foremost, this person is very, very lucky to have an immune system. And we all know people that, I mean, think of a couple of my kids. They never get a cold, you know, and why? We are all distinctly different based on how and where we were raised, the things we're exposed to that fire up our immune system throughout our life and give us protection against certain pathogens that are in the environment, okay? So the likelihood that the vaccine had anything to do with negatively impairing her immune system is really remote. I mean, probably not possible because it doesn't work that way. The fact that she's in a school and she did not get infected, there are many people that live among people that were infected and they don't get infected. I did fine for months. In fact, I'll give you my example. I was exposed pretty regularly. I took right precautions, washing hands, masks and such, but probably several months after I got my booster, I got COVID, okay? But it wasn't a real bad infection, okay? And I recovered. So I could say, well, gee, you know, then people say, well, could the vaccine have had something to do with it? No, it's just at that time and for what many reasons that we don't fully understand, you got it. And everybody listening should not equate vaccine with causing a problem. Because as Dr. Lewis said, these are different types of vaccines, these mRNA, for instance, vaccines, and it's unlikely that they're going to impair your immune system. You might get a little bit of fever, you might get a sore arm, you might not feel so good for a little while, and I mean for hours or a day, like when you get a normal flu shot. But the risk-benefit analysis is clearly highly, highly on the side of getting the vaccine.
Thank you, Dr. Cremona. I'm going to go now to Mr. Sample, again, the interim director of the Northern Arizona VA healthcare system. And Mr. Sample, I'd be curious to know from you, in that demographic, what are the challenges that you're hearing about for the veterans who you are caring for?
I think that's really a good question. And part of the challenge that we have is really time and distance to get to the veterans and for the veterans to get to us. So, you know, just like the state and Dr. Wright talked about the ability to, and they'll go to deliver the vaccine, we did the same thing. I mean, for months, we had been ferrying vaccines across Northern Arizona just to do outreach to our veterans. You know, early on in the, as coronavirus was unwinding and the vaccines came out, we had really a high demand. It was a supply demand issue. So the demand was high and the supply was low. As that started to equalize, what we saw was the demand started to wane. And what we see now is little spikes. So the spikes in vaccine interest seem to track as COVID is on the increase. Right now, it's kind of on the decrease post Omicron. So we peaked here in January, really, with the Omicron virus in northern Arizona. But we saw an increased demand throughout up into the beginning part of January, and then the demand started to fall again. So what I would encourage the veterans to do is get ahead of that, get on the front side of that, get vaccinated now if you're not vaccinated. If you've already been fully vaccinated and it's been several months, then I would recommend them getting the booster vaccine. And again, it's not, Dr. Cremona shared his experience, I shared mine. The benefit was when I ended up getting the coronavirus, I wasn't sick very long. And again, I shared earlier with my opening remarks, what we saw with our patient population is those patients that had been vaccinated were much less likely to be hospitalized. And I think really that in of itself is a huge victory with getting the vaccine. So thank you.
Carrie, it might be worthwhile if I just, Colonel Sample comment, because for a couple of decades, he's an Air Force physician who's deploying troops all over the world. And maybe it's worthwhile commenting about, we have young, healthy people, they get vaccinated. Did you ever see anything that, other than a mild fever or problem from getting vaccinated as we deploy our troops all over the world?
Yeah, so that's a good question. And Dr. Carmona, I wasn't a physician in the Air Force. I was actually a pilot. So
that's right.
I was on the receiving end of many of the many of the vaccines that I got. But again, what we see here, and I haven't personally seen any severe adverse reactions here that we've had, and I'll have to get back to the audience because I don't have any data that whether we had one or not. But generally speaking, the veteran population and our employee population has done very well with getting the vaccine. And again, it's the important piece is doing it, getting it taken care of to stay out of the hospital, because it might not prevent you from getting the coronavirus, but it will really help with your recovery on the backside of that virus.
And Dr. Carmona, I wanted to direct this question to you. Why are you, this is not directed at you, this is just me asking you from the viewer. Why are you continuing to talk about vaccines and boosters when everything I read says COVID-19 is going away and a bunch of states are loosening their restrictions?
Well, that's a great question. And the loosening restrictions is very different than vaccinations, okay? And the new recent CDC guidelines talk about, depending on transmissibility in your community and depending on resources available in your community, that is the availability of doctors, beds, ventilators, different communities can make decisions to reduce, for instance, masking. You should still wash your hands. You should still be careful, and you should still get vaccinated, because still about a third or fourth of our population nationally is not vaccinated. And so what you have there is a reservoir of people who can get infected, allow the virus to be able to replicate, that is, grow in your body. The more it grows, the more chances it has of changing, mutating, creating a new variant, and potentially you could have a problem. This morning on the White House call with Dr. Fauci, Dr. Walensky, and others, these topics came up. The longer we go and don't achieve herd immunity, the more likely it is that we could get a variant that could be problematic. So getting vaccinated is not only about you, it's about you protecting your community and adding to the protection of the nation and the world. Because even if we get our 330 million people in this country vaccinated, there's 8 billion in the world. There's millions who aren't vaccinated. So think polio. When I was a young kid, moms were afraid to send kids to school. Sabin and Salk came out with a vaccine and it took years. But now polio, the virus is still there, but it's got no place to go because we vaccinate all our children. We have to get to that point where we achieve true herd immunity, and that slows down that virus from mutating and causing more problems. Therefore, that's a great question, but I would urge that person to please get vaccinated, because you'll help yourself, help your community, help your nation, and help the world.
Well, and Dr. Carmona, there have been a fair amount of questions about herd immunity, and one viewer says, haven't we reached herd immunity already? Haven't enough people been vaccinated? I know you just touched on that, but I think it's worth just exploring just a bit more.
Sure. Well, first and foremost, there's no exact number for herd immunity, but you want to get up there into the 80th percentile, 80, 85, 90. The higher you get, the better, because what that says is the virus can't transmit anymore, because if you're immune and you've had the disease or vaccinated, so you can accelerate herd immunity by getting vaccinated, or you can just wait until you get the disease And then what happens there is if you let herd immunity occur naturally, it's much more costly in human capital, people dying, people sick, and exhausting our healthcare professionals who, to put it in combat terms, we've been at war in battle for over 2 years with an invisible enemy who's decimating our country and the world. Almost 1 million deaths in this country, coming up on 1 million deaths right now. This has eclipsed what happened in the so-called Spanish flu of 1918 and past that. So the fact is that vaccination is still very important. We're not out of the woods yet. Some of the numbers are looking better. The trends are heading in the right way, but we should not be complacent. We should still wash our hands. In large gatherings where you don't know who people are vaccinated, you probably should wear a mask, especially if you are immunocompromised, especially if you're a senior at risk. Take every precaution. Yes, it's an inconvenience, but death is a big inconvenience, okay? And being in a hospital on a ventilator is a big inconvenience. Take extra precautions. So that's right off the press from this morning, CDC the last couple of days of how we're dealing with that. Don't confuse vaccination with relaxing some of the masking requirements based on transmissibility in the community and the resources that are available to care for people should there be another surge.
And I want to go now to Ms. Kutalski, the director again of the Southern Arizona VA healthcare system, and just ask you at this stage in the game, as Dr. Carmona was talking about, the situation is changing and there's new headlines attached to this. And so obviously the public is wondering what comes next. What do you feel where you're serving, the veterans you are serving, is your biggest challenge and concern right now?
Well, I think as Dr. Cremona mentioned, we want to keep the vigilance, high and make sure that we continue to promote the hand washing and the safety standards. All of our federal facilities as hospitals still require masking by any visitors that enter the facility, particularly because we have our most vulnerable patients or veterans coming in. So we want to make sure that we're still being mindful of that. So even though maybe the community is relaxing with masking, we are not here at the VA, because again, our veterans are our number one priority and keeping them safe is very important. I think that we also are looking at, different ways that we can engage with our veterans. All of us have seen technology really expand. We're now able to do a lot of our appointments through virtual technologies, which I think is one of the good things that has come out of COVID, really giving us the ability to, where veterans can stay in their home and get many types of services through these virtual platforms, whether it's mental health services, primary care services, even some specialty services we're able to offer through our connection through telehealth. So if there are veterans out there that want to know more about that, maybe they've been hesitant to get the healthcare that they maybe have been putting off because of being nervous about, coming to a healthcare facility, there are ways to be engaged, and we can connect them through many telehealth modalities. So really encourage veterans to reach out to their primary care physicians and find out what services are available from their local VA. Thanks.
Well, Ms. Kutalski, you bring up a really important point, and that is for a lot of veterans concerned about cost relative to their health care. And a lot of times that prevents them from getting the health care they so desperately need. A question comes in here, and perhaps this is good for you, Ms. Kutalski, or for you, Dr. Smith. And the question is, are veterans benefits able to help with care in the home and not just in a nursing home or in an assisted living situation? So when you talk about telehealth, how do you answer that question for this veteran?
I certainly would encourage veterans to reach out to their VA or through the benefits office to find out what they may be eligible for. I always think that it's interesting because laws can change over time, and maybe someone who wasn't eligible for VA services may be now. And I know that Colonel Wright and her team have many folks that are available to help with assistance. Our veteran service organizations have folks that are trained to help folks with benefits and see what their eligibility may be. But certainly also for the VA, for the healthcare portion, feel free to contact our enrollment offices and talk through our experts there. And they certainly can walk a veteran through what may be eligible for them as well. Colonel Wright, I don't know if you wanted to add anything further on that.
Yeah, one shout out to Jennifer for remembering about our veteran benefit counselors. So I think it's important, at least on this call as well, to support all the other concerns and struggles that our veterans might be having, right? Not only is it about COVID, but it's about many other things. So the specific question I do believe is about sort of in-home care versus going to skilled nursing. And we have veteran benefit counselors who can serve our veterans to help them understand that there are all options to going to skilled nursing, one being aid and attendance. And so I just want to give out this number really quickly. Our veteran benefit counselors have an appointment line, and that appointment line is 602-535-1215. Again, it's the veteran benefit counselor appointment line, 602-535-1215. And they can answer any of those types of questions of services and benefits that you may have earned. And maybe you didn't think you had them before, but you may have them now because laws change all the time. And so does VA policy. So please reach out to them if you have any questions.
Colonel Wright, thank you very much. Dr. Carmona, I want to ask you a question that has come up again and again that I've seen is concerns about, getting vaccinated against COVID-19 over and over. This person says twice for the initial vaccination and then booster doses. How should people try to gauge their health concerns there? Because as you know, you hear it, I'm sure, all the time. There are a lot of people who are very concerned about the prolonged health effects of this.
Sure. Well, these are very important questions. And again, once again, I'm very happy that we're having the opportunity to address some of these questions that confuse our veterans and the public in general. The fact is, every day in your life, you are exposed to what are called antigens, things in the air that you breathe. You cut your finger. So these things elicit an immune response, okay? When you get vaccinated, it's giving you an antigen, which is, look at it as a chemical that goes in to fire up your immune system against a specific disease, in this case, COVID. So let's say, let's put COVID aside for now. Every day you're exposed to stuff and your body has certain immune levels against certain pathogens that it sees all the time. Some it can recognize and say, well, this won't hurt me, I don't need to deal with it. Some it says, I need more antibodies because this could hurt me. So all the vaccine does is introduce this to you to help you and help your immune system get stimulated. After the first vaccines, a number of universities and labs around the country started to look at how long did that immunity last. And what they were finding was that at about 5, 6, 7 months, it started to drop. The problem was we didn't know exactly where it was going to impact your immune system because, not to complicate the matter, there's different kinds of immunity. There's cellular immunity, there's different cells that provide immunity. So I'm just speaking in general. So you follow this graph and then you see it starts dropping. So the scientist said, you know what? Since we don't have a lot of experience with this and it's dropping, potentially these folks are at increased risk. So we should give them a booster. And then that boosts it up. So now we know after the booster, we're finding that again, at maybe 5 to 7 months, it seems to be dropping. And that data will probably be reported in the next month or two to see, is it worthwhile to advocate for another booster for seniors and people that are at high risk? Again, that was just discussed this morning on the White House call with Drs. Fauci, Walensky, and others. So that's the science I alluded to that's going to continue to change. This is it. There's people all around the country in different labs following this and will be able to give more precise information. So it does not hurt your immune system. In fact, the idea is to enhance your immune system to continue the protection forward while that virus is still circulating. Okay, that's the important thing. It won't hurt you. It will, in fact, enhance your immunity to protect you for the next period.
And Dr. Smith, I'd like to ask you a question here. There are several questions from the veterans who've interacted with us. Are the booster shots and the booster doses free?
That's a great question. So thank you for asking. I love to have the opportunity to clarify this. And so yes, for veterans, for their caregivers and spouses, the vaccine can be administered at the Phoenix VA or at any of our VAs at no cost. And so it's a matter of just coming in and letting us know, and we will be happy to administer the vaccine. to the veteran spouse, and or caregiver as well. And while we're talking about cost, I'll just add one thing that's really important is sometimes as veterans are out in the community and traveling, you may find yourself in a situation where you need urgent or emergent care. And so I just want to remind veterans that eligible veterans, that urgent care is covered. And there's a number that you can call to check your eligibility, and that's 698-2311. That's 844-698-2311 or MyVA 311. And then if you happen to end up in an emergency department, then there's a number for notifications, and that is 844-724-7842. And so as Director Wright said, we understand that when we're talking about veterans care, comprehensively, there may be a number of things that can influence or concern veterans about your care. And so we want to let you know the resources that are available to you now and in the future. And there's been lots of changes around urgent care coverage for eligible veterans who have received care within the last 2 years. And so if you have any questions or concerns, please do reach out for that eligibility. And the vaccine is of no cost.
Thank you so much for that. And I do want to go now to Dr. Karen Lewis, again, the Immunization Program Medical Director. And I apologize, Dr. Lewis, I know you were raising your hand a minute ago and I didn't see that on my screen. So go ahead, the floor is yours.
Oh, I just wanted Dr. Cardona explain things very well. I wanted to point out that some vaccines, you get 2 measles vaccines and they last you for life. But people are used to, for example, getting a tetanus vaccine every 10 years, and the immune system needs to be reminded. And then with the influenza vaccine every year because of changes. At the beginning, when the vaccines were being developed, people said, ooh, we don't know how long these vaccines are going to last because different coronaviruses can cause colds, and immunity from those colds wear off fairly soon. Right. So we're seeing that, yes, this is wearing off. Hopefully scientists can make vaccines that will last longer, but we're at least blessed to have vaccines that have saved hundreds of thousands, if not over 1 million lives in the United States. And my motto is disease is bad, vaccines are good.
Thank you so much, Doctor. And Dr. Carmona, since you were talking about that you're on these White House calls and you obviously have, a lot more intel than we, well, at least me, the rest of the folks are a lot more distinguished. But I'd like to know, what is the level of concern about fatigue in Arizona and in this country about COVID in general? It's just from a mental health perspective, and how are you combating that to try to keep folks, especially as pertaining to our conversation today in the veteran community, vigilant?
Well, first of all, this is equivalent, to combat exhaustion. We call it COVID exhaustion. We're in here over 2 years now. Think about, I guess the best way when I communicate that we have looked at to take the burden off of our first line responders because of what we recognize to be a mental health problem. The last thing I'll say, even when COVID leaves, we will be burdened with a long-standing mental health challenge as we move forward. Just like we still have veterans from Vietnam in our hospitals and our outpatient facilities with depression and everything from depression to more complicated things like PTSD. This will have a burden in our society of non-veterans as well that is going to be very costly as we move forward, but equally important. So I'd ask Jessica to comment on the specifics because she was, running the point on this for the state for quite a while and figuring out innovative ways to take the burden off our frontline practitioners.
Thank you, Dr. Carmona. That is certainly something that's still in the longer term planning stages as far as what comes next after this immediate response in order to support the healthcare and frontline workforce. in rebounding and seeking resilience. And we're partnering with lots of different groups in order to determine how we can improve the pipeline for healthcare professionals and how we can support professionals in their jobs who have gone through this tremendous trauma throughout this response. But then also looking forward as a public health department to some of the other effects for COVID on our populations in general from the health perspective. We know that there have been delays in care that people have experienced because and so we've got a pandemic recovery and resiliency plan that we've developed at the department in partnership with a whole host of community and other state agencies in order to address some of these impacts over the next 5 years.
Jessica, thank you. And thank you so much for your hard work and your team's hard work on this. We just have a few minutes left. I want to let the audience know if there's a question that we didn't get to, or perhaps you think of it later, you can email aztownhalls@azdhs.gov. As we close things out here, I thought it might be important to just give each of our distinguished panelists a final word. And Dr. Cremona, I want to start with you. And then of course, Colonel Wright, I'll have you wrap things up when we're all finished, but I'll just kind of go down the line and reintroduce, if you will, each panelist to share a few final words and whatever you think is urgent for people to take away from this conversation. Dr. Carmona, please go ahead and share.
Thank you. And first and foremost, a big shout out to all of my colleagues here. In the military sense, the uniformed services, we have a common mission, and that is to address the needs of our veterans and those who have served. And so we couldn't do this without this team approach. You've seen the diversity that we have here on all the pixels across the top, and not only in gender and ethnicity, but also in competencies in different areas. And so I'm very proud of that. I think the most important thing I would say to my battle buddies that are out there, our fellow veterans, is don't be swayed by misinformation, by stuff out there where people are just trying to get page turns and get attention. Call the VA, call Colonel Wright's office at the state. Go to reputable practitioners who can answer your questions. But most important, as a fellow veteran, I'm telling you, get your vaccine, get boosted, and practice the appropriate mitigation strategies in your community based on transmissibility. That's what we need to do to get out of this. We're on a mission together. We all want to survive this mission, and we have the tools to do it if we can all pull together just like we did in combat.
Thank you so much, Dr. Carmona. And Dr. Smith, I'd like to go to you next, and just remind the audience, Dr. Smith is the director of the Phoenix VA Healthcare System.
Thank you. So what I would say is, personally, as the daughter of an Army veteran, my dad is not with me, but if he were here, just as you heard my colleague, Ms. Kutalski say, I would have had him in line to get his vaccine. I would say that as an organization, the Veterans Health Administration really focuses on preventive health care. And the tool of the COVID-19 vaccine is one of those measures that we have, or one of those tools that we have. And so I would encourage every veteran to take advantage of that resource. Currently, about 72% of the veterans we serve here in Phoenix have been vaccinated. So that's great. But it means that we have 28% that we haven't been able to reach. And so I want you all to know, and I actually want to ask for your help in encouraging your battle buddies, your members of your veteran service organizations and veterans that you interact with to consider the COVID-19 vaccine and have those conversations with your primary care providers or the members of the team here at Phoenix VA. 88% of our veterans say that they trust the Phoenix VA with their healthcare. And so if that's in fact the case, I want to encourage veterans to consider having more conversation and more dialogue to better understand why this vaccine is so important. And then finally, I would just say that for all of your healthcare needs, that the Phoenix VA really is pleased to be a part of your healthcare. And we know that veterans are continuing to choose the Phoenix VA. They're voting with their feet. We're privileged to be able to provide that care and honored, and we intend to continue to support the mission of caring for
Dr.
veterans.
Smith, thank you so much. Jennifer Kutalski, again, is the director of the Southern Arizona VA Healthcare System. A few final words from you, Ms. Kutalski.
Yes, thank you. You know, earlier we were talking about the stress and the burden of what COVID-19 has done to all of us. And I would be remiss if I didn't take an opportunity to remind everyone that there's a Veterans Crisis Line, and anyone can call that number if they have concern either about themselves or about someone else. And I want to just share that number to make sure everyone knows it. It's 1-800-273-TALK, 8255. So if you know that someone is in crisis, please reach out, use that number. Anyone can use it to be able to help those that may be going through a very tough time. And I'll just also echo that, you know, our staff have been the heroes throughout this pandemic. We're very grateful to them. And I know all three of our healthcare systems are hiring, and we love hiring veterans. So if you are interested in that opportunity, please take a look at what may be available on USA Jobs and about being part of our team. And then final note to all of our veterans, thank you for your service. And please, you know, reach out to our VAs. We're here for you. Find out about what services you may be eligible for. Our Southern Arizona VA healthcare system number is 520-792-1450. Don't be hesitant to reach out to ask any questions. We're here to help. Thank you all so much for the opportunity today.
Thank you so much. And I really appreciate you giving out that crisis line. That is really important information. And now Stephen Sample, who again, reminding folks, the interim director of the Northern Arizona VA Healthcare System. Mr. Sample, some final words from you.
Yeah, great. If you have and you're on this call, share this information with your fellow veterans. It's an opportunity to help educate them and get the word out. You know, I think what came out and very evident throughout this pandemic was our ability to work very closely together. So the three VAs in Arizona and Wanda Wright and her team at the state have really partnered together. And I think that, you know, for all of the veterans in Arizona, that's really important because we're able to work together to ensure a continuity of services for all of our veterans. And, you know, as we see the coronavirus wane a little bit at this time, you know, I look at across for our specific demographics here in Northern Arizona, we're currently at 68% of our veterans have been vaccinated. So while that's good, that's still below that about 80% that Dr. Carmona mentioned when he was talking about trying to get toward that herd immunity. And as I look at the demographics across Northern Arizona, we have some outlying areas. So if I look at Mojave County, for instance, we're only at about 56%. And again, those are for people that the VA is tracking, that the VA has provided vaccines for our veterans. And that's true over in Apache County as well. That's a more rural area. It's harder for us to reach. And the population there is less likely to be vaccinated. So please, if you have contacts in that area, encourage them to get a hold of one of the VAs. We're happy to serve them. That's in our area for Northern Arizona. And just as a reminder for those that haven't been vaccinated, or if you're interested in the booster, please call our vaccine clinic. That number is 928-717-7406. Thank you.
Thank you so much, Mr. Sample. And I know a lot of information being given out today, which is obviously the point of this town hall. And you can watch this on replay to make sure that you're able to utilize all this important information. I'd like to get a final remark now from you, Jessica. A reminder to the audience, Jessica Rigler is the Assistant Director for Public Health Preparedness. Jessica?
Thank you, Carrie. Once again, I want to thank all of you for joining us today. Thank you for your service. I don't think that I can sum it up much better than our colleagues. Really, we expect COVID-19 to continue circulating at some level here in Arizona, and that's why vaccinations are so critical to protecting the health of our communities and the health of individuals who are too young to be vaccinated right now or immunocompromised and those sorts of things. So please go out and get your vaccine, get your booster shot, talk to your healthcare provider if you've got specific questions related to your situation. And thank you for being so engaged.
Thank you, Jessica. And finally to you, Dr. Karen Lewis.
I've spent my whole career fighting against infections and knowing how good vaccines are. I would not be telling you that this vaccine is safe and good if I didn't know that COVID could be terrible and know that the studies have shown that these COVID vaccines are very, very safe. So please do the safer thing. Get the vaccine, protect yourself from long-term side effects from COVID. It's worth it. Thank you.
Thank you, Doctor. And to all of our panelists, I appreciate all of the information here today. For myself, as a journalist, I think one of the most important, vital things we can do right now is continue the conversation. I want to let the audience know no questions were off limits to me. No one told me, ask this, don't ask this. So we want to get everything on the table because information is key. And I really appreciate this team behind the scenes here being so willing to have such an open conversation. And with that, Colonel Wright, I will toss it back to you.
Thanks so much, Carrie. As a matter of fact, I was just over at the Phoenix VA last week getting my booster shot, and it was a very excellent experience. So thank you, Dr. Smith. I just want to thank everyone for attending this town hall and engaging in this conversation with us. I especially want to say thank you to my VA counterparts, Dr. Smith, Steve Sample, and Jennifer Kutalski. We make a good team. Special thanks to the ADHS team for setting this town hall up and ensuring that everyone who couldn't watch live can watch later on YouTube or on the ADHS website. I hope everyone found this as valuable as I did, and hopefully you got your questions answered. To the veterans joining us, remember that we're always here for you, your families, and your needs. Always reach out when you need to, and we'll do whatever we can to support you. Take care, stay safe, and thanks again for joining us.